Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's episode, we're going to discuss a medication known as Nadolol, or Corgard as a brand name. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. In this video, we'll discuss the mechanism of action, or how this medication works, indications or reasons we would prescribe Nadolol to a patient, followed by contraindications or reasons we would not be able to prescribe this medication. We'll then touch on examples of dosing and finish it off with side effects with percentages. I've put together some slides to go over this information, so let's just jump right into it. So the first thing to discuss here will be the mechanism of action, or how this medication works. So Nadolol is a non-selective beta blocker that competes with beta-adrenergic receptor agonists or available beta receptor sites. It blocks the chronotropic, inotropic, and vasodilator responses to beta-adrenergic stimulation by inhibiting both beta-1 and beta-2 receptors. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used in the treatment of hypertension or high blood pressure, as well as in the treatment of chronic angina pectoris or chest pain. With respect to contraindications or reasons we would not be able to prescribe Nadolol, we wouldn't give this medication to a patient with bronchial asthma. As well, we would also not give this medication to a patient who had overt cardiac failure. A patient with sinus bradycardia and greater than first-degree conduction block would not use this medication, and neither would a patient with cardiogenic shock. Now for some examples of dosing with Nadolol. So in the treatment of hypertension or high blood pressure, the initial dose would be 40 milligrams orally once daily. This dose may be increased in increments of 40 to 80 milligrams up to 320 milligrams once daily. The usual maintenance dose, however, is 40 to 80 milligrams once daily. In the treatment of chronic angina pectoris or chest pain, the initial dose would again be 40 milligrams orally once daily, and this time you can increase the dose in increments of 40 to 80 milligrams every 3 to 7 days. The maximum dose in this indication would be 240 milligrams per day. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Nadolol, so I'll go over some of those here now. 2% of patients may experience a bradyarrhythmia, dizziness, or fatigue. The more serious side effects would be heart failure, which may happen 1% of the time, atrioventricular block, or a cardiac dysrhythmia. Alright everybody, that's all we're going to talk about today with Nadolol or Corgard. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.